My name's Alana Erickson with the Winnebago County Health Department, and now we're going to catch you up on what Rethink has been up to. Today I have here with me Dan Hinton, part of Rethink's Leadership Council, and Emily Deringer. She is the Rethink Coalition Coordinator. So we're going to start with Dan. Can you just give us a little recap about Rethink, how it stemmed, a little history about it?
Sure. It's a long history, actually. It starts way back in 1992 with the Tobacco-Free Coalition, and then moved into the Drug-Free Communities grant in 08,
Yeah.
I think it was.
Yeah.
So we got this big Drug-Free Communities grant, and then started to make a bigger organization that was broader, started to branch out into substance abuse prevention. Is the biggest change, I think, there. And then, 2011
Yeah, about
shifted again to include the CHIP, the Community Health Improvement Plan, and make that a part of the planning and broaden off into the other areas that CHIP was involved with healthy living and obesity and those kind of areas too.
Okay. So as it expanded and got a little bit more involved, it started to take on a structure. And can you explain a little bit of that for us?
Sure, it's a big structure. There's the leadership group is kind of an overseeing group to kind of keep everything communicating well and bounce ideas off of. But there's teams then to work on different project areas, and the project areas now come out of community input. So that collaborative work is really a huge issue for Rethink now, is much more responsive to community input than ever before.
Yeah.
It was driven by grant dollars prior, and now it's much more by needs of the community.
Yeah, and that's the really neat part about Rethink, is that community members can be a part of it. It's not just, people that do this for their job kind of a thing, but
So
all
who is
groups.
involved?
Well, there's a great deal of organizations involved, but also just community members too. We have folks that are retired and involved as volunteers. Other folks are on other boards, but also nonprofits, a great deal of nonprofit organizations, law enforcement, some clergy. The folks that are involved are interested in the ideas that Rethink is invested in, the health and community activities.
Yeah.
So.
And what has the focus up until now kind of been? I mean, you've had your focus areas of Rethink. What are those that people are working on?
Well, they're really kind of driven by CHIP, aren't they?
Yeah,
The CHIP
so I mean,
program.
the biggest ones are, like Dan said, tobacco and drug prevention, alcohol and drug prevention, but also mental health has been, our work in mental health has really expanded over the last couple of years, mostly because of community need and desire to work on improving access to mental health services and other things related to mental health. But then also some of that obesity prevention work, like working on physical activity, making it easier for people to walk, be active, and making it easier for people to get access to healthy foods, fruits and vegetables,
Yes.
those kinds of things. So all the different aspects of what people think is healthy, that's what Rethink is all about.
Great. Well, that's a little 101. What can you tell us some of your big accomplishments that you guys have done over the past few years?
Well, it started off with tobacco way long ago when the first efforts were around restaurants. It's hard to imagine now going into a restaurant where there might be smoke, but that was a thing that was still around in the early 90s. So that shifted, and also into some of the other projects that we've moved into. The Youth Risk Behavior Survey, we got that involved in all the schools in Winnebago County, and concurrently. So we got all the data from the schools at the same time throughout the county, which had never been done before.
Right.
That was really an accomplishment.
Yeah, and that data really helps us take that community input and see if are our efforts making a difference, especially when it comes to youth, substance use, or in this example, mental health. One of the biggest drivers of why we wanted to work on mental health was because we were seeing no change and actually an increase in students reporting that they were sad or depressed a lot of the time. So that data is super important.
Sure. The Mental Health Share Shop was formed out of that effort to move into the mental health arena, looking at what services were available, where were the gaps. The community wellness screen for students kind of came out of that then too. So we had this ability to screen students in schools and refer them on to services that were available to them. get counselors right in the school if we need to do that.
Yeah, and the Heroin Task Force for Winnebago County is another kind of, it started, infancy was in Rethink, and it's expanded into its completely its own coalition, its own work, and is just as big as Rethink now. But the Heroin Task Force, and one of the keynote kind of features of something that anybody would have probably seen is the Rethink Addiction Run.
Right. Is big in that yet. Still, that's a major effort for Rethink. Yeah, and the funds raised from that go back into the Heroin Task Force and back into supporting work that Rethink does. So that's one of kind of our signature things, I guess. I think so. That's very visible in the community. Yeah. Some of the newer things have to do with food, though, where we're getting foods from farm to school program, where we're getting the local districts purchasing from farms, getting it into the schools, having taste tests for the students. Yeah, and school gardens too. That's right, school gardens. When you drive past school or walk past, hopefully you walk past school, you'll see those raised beds, and we help do those, or we think our community members help put those together, along with Growing Oshkosh, of course. Right. Another area that's been with retail then too, though, trying to get the menus to be listed as this is a good meal for kids, this is a good meal for people, healthy plate. Smart plate, I'm sorry, they call it smart plate. Yeah. To get those foods, fresh foods into the restaurants and mark them for the people that are purchasing. Yeah. So they know it's going to be a good one. Right. And then one thing that's near and dear to me, been my baby for the last couple of years, but our Winnebago County Bicycle Pedestrian Plan, it's a rural plan that covers the parts of the county that aren't already covered by an existing bicycle pedestrian plan, so we're really, really excited to see where the implementation of that goes to make it easier for people to get around by biking or walking. So increasing physical activity opportunities, we're really excited about that. That is a great one.
Well, I mean, you guys have just given us a taste of some of the stuff that you've accomplished. It's obvious that Rethink has done so much for the community, and you continue to do so, but you kind of are changing gears and reevaluating. Tell us a little bit about that. We got a little time left.
Yeah, so like Dan said, a lot of Rethink's, what we work on is driven by community and what the community wants to work on. So we asked what are some of the problems, and we've identified some of those problems, and we're hoping that we can get a lot of folks together in the next couple weeks here or depending on when you watch this, it might have already happened, but you can still join. It's okay to get involved with Rethink. So we're going to be having 2 launch events, I guess, and the graphics up on the screen here. So they're on Tuesday, the 28th of February at 5 p.m. at the Oshkosh YMCA, the 20th Avenue location. Or if you're up in the northern part of the county, we're having another one. Same thing, you don't have to go to both. On Thursday, the 2nd of March at 10 a.m. at St. Mark's Lutheran Church. So we'll have some conversations, kind of present again what Rethink is, what Rethink does, and then we'll have some conversations and get planning on what kind of solutions can we come up with to address some of these problems in the community to improve health.
Yeah, this is really a way for citizens to get involved in some change, real meaningful change that they'll be able to see.
Okay. Yeah. And are you looking for other folks to be involved in leadership or long-term, or is this just a one-stop, come and give your opinion?
It could be both. I mean, ideally, we want people to be there for kind of the long haul. At least, a year or 2 would be awesome. But if you're there and you can only commit a little bit, sure, we'll take your little bit. So the strength in Rethink is the community connections we have and all the people that are involved. So
great. Well, I know you guys will continue to do good work. You can find more information about that at www.rethinkwinnebago.org. You can also find them on the web through social media channels like Twitter and Facebook. Well, thank you guys for stopping in today. It's great to catch up and hear what you've been up to.
You bet.
Again, this is the Winnebago County Health Department's TV show where we're talking about public health and how it affects residents here in Winnebago. You can catch us online at www.winnebagopublichealth.org or on social media at Facebook and Twitter. Thank you.